So tell us, Brendan, just a little bit about your concerns about the abortion legislation that's currently being discussed.
Well, my concerns, Wendy, are that whilst there's an apparent allowance for freedom of conscience within the bill, the reality is that that's not the case. What Simon Harris and the government are saying is that whilst a doctor, midwife or nurse can abstain from actually performing the procedure, the abortion procedure, they cannot remove themselves from referring and transferring care, as they put it. And quite frankly, the word care is a complete misnomer here. As we know, we're talking about a procedure that's deliberately ending a life, and this is new. This is a reinvention of medicine and healthcare, and it is not healthcare, as we know. And also the idea that a doctor would be forced to refer a patient, i.e. recommend that this procedure is going to be beneficial, is completely counter to our ethical beliefs and our values, and it's simply not good medicine based on evidence-based. So that's why I've huge concerns, and as do a huge number of my colleagues.
In terms of other countries, is there a GP-led abortion service in other countries?
The simple answer to that is that there isn't, and that's why what's happening at the moment is it's a first in many ways, but in particular in relation to the fact that this was proposed to be GP-led. And I think that it's important that people recognise that, and that there's huge resistance to this on the ground amongst GPs. I think that that's not something that's known, in that from studies that we've done and that have been done to date in terms of surveying GPs using large representative samples, anything between 75 and 85% of GPs have said that they do not want to have anything to do with this, and I think that needs to be highlighted. So
that is obviously going to have a huge impact. If the Minister for Health won't change his stance on conscientious objection, what impact do you think it's going to have on GPs and the medical profession in general in Ireland?
Well, I think it's going to lead to an unnecessary conflict, really, and if the Minister continues with his proposals, then what's going to happen is that doctors such as myself and others, and there are a large number of us, as I said, will simply be brought to task, brought to the courts, and will potentially be struck off.